panel discussion led by Dr. Shahid Jameel, who's currently director of Trivedi School of Biosciences at the Ashoka University. He will start with a brief presentation. I'll be handling his slides from my end. And after that presentation, I would request Professor Kavindi, Professor Sanghamitra, Professor Sumitra Das, and Professor Umesh Varshney to turn on their video and audio. Dr. Shai Jamil, could you? Yeah. Good afternoon, sir. Good to see you. I'll put the slides on full screen mode and I'll go to the first slide, and when you say, I'll move.
Yeah. Thank you, Shashank. I guess you can hear me, right?
Yes.
Okay, wonderful. So what we'll do is I'll go through some general aspects of the pandemic in about 15 minutes, and then we'll get on with the panel discussion. Can you move the next slide, please? Okay, so that's the current situation of the pandemic. More than almost 51 million people have been infected. These are the confirmed cases, roughly 1.26 million deaths across the world. And if you look at the map here, a couple of things become quite apparent, and that is that much of the developed world has really borne the brunt of the virus. If you look at the red dots, but India also has not been spared. We are in number 2 place in the world in terms of the numbers of cases, but it's quite apparent that parts of Africa have seen very little disease, and this is something that is curious. It is, people are trying to understand this. The graph on the right is the daily cases, and you will see that the daily cases have kept on rising and rising. So there isn't really the outbreak is not really slowing down globally yet. Next slide. So here is the situation in India plotted dynamically with various other countries. And there are a couple of points to be made here. India started late, but picked up really quickly during July, August, peaked around mid-September, and then the outbreak has started to go down. On the other hand, if you see countries like the European Union, US, they peaked early, went down, and then they're coming back up again. So this is what is sustaining the outbreak globally. It slows down in one region, picks up in the other, and then the second wave sort of has started in the West. Next slide. So here are some numbers. India, as I said, is in number 2 place with almost 8.6 million confirmed cases, 127,000 deaths. So in India, the case fatality rate works out to about 1.5%, 1.47 to be exact. The recovery rate as of yesterday is 92.6%. So those of us who think that the outbreak has really slowed down in India, we are still contributing over 8% of the world's COVID load and over 7% of the global deaths. At one point, we were contributing 24% of the world's cases and about 15% of the world's deaths. So in a sense, it has slowed down, but we're not down yet. The other question which is often asked is India testing enough? India is currently finding 1 positive case after 14 tests. WHO recommends that you find 1 positive after 20 tests, so we still have that gap to make up. There are parts of India where testing is not happening very well. There are parts where testing is happening very well. There are parts where more antigen tests are being deployed, which has its own issues. Next slide. If you see where the cases are coming from in India, these are sort of the top states from where cases have come. And if you look across the graphs, you will see that Delhi is really on the rise. Kerala is rising, West Bengal is rising, and Bihar for some reason is going down. Well, we'll have to wait and see that. But testing again has to do a lot with this. So Delhi, for example, is putting out about 7,500 cases per day. But Delhi is also deploying 77% antigen tests and 23% RT-PCRs. So the 7,500 cases per day in Delhi could easily be somewhere in the range of about 12 to 13,000 cases. And this is something that today in Delhi you can actually see on the ground. Hospitals are filling up. Even government hospital ICUs, which had a lot of capacity available earlier, don't have much capacity available at this point. So the situation is looking quite bad here. Next. I'll address three myths. One myth is that India's recovery rate is high. Well, that's logical, because if the death rate is 1.5%, the recovery rate should reach 98.5%. It is currently 92.6%. It has been rising, and it should attain that 98.5% level based on the death rate. So there's nothing really special about it. The second myth is that India's death rate is low. And I would like you to look at these figures. Firstly, the world average is 2.4%. India and Bangladesh are almost the same. Pakistan is a little higher. Nepal and Sri Lanka are much lower. So our death rate is low if we compare ourselves to Europe and US, but our death rate is not low if we compare ourselves to our neighborhood. And really, that's the context we should be looking at. The graph up here tells you total cases per million population, and the red line shows you deaths per 1 million population. And again, you will see that India has possibly the highest deaths per million in the region compared to other parts of South Asia. So this is a myth that has been propagated. This is not really true. Next. Next slide. The third myth, which has really been floated globally, is that COVID is nothing more than flu. And here is the data. Can you go back? Here is the data to show that that's not true. The red lines represent various studies of mortality in COVID patients across different ages. The blue lines show seasonal influenza data for the last 6 years from US CDC. So basically, the take-home message is that if you're a 30-year-old, you have a threefold increased chance of dying of COVID than you have of seasonal flu. If you are a 70-year-old, you have about 14 times higher chance of dying of COVID than you have of seasonal flu. So bottom line is COVID is not seasonal flu. Next slide. Let's look at India's lockdown. Was it successful? If you look at the growth rate in the outbreak, definitely in the first lockdown, there was a rapid fall in the average growth rate in active cases. This slowed down in second lockdown, third lockdown, and by the time we came to the unlock phase or in the post-lockdown phase, the growth rate of active cases has stabilized. The point is that the lockdown was successful initially, but then it was really a case of diminishing returns. There wasn't really much happening in terms of controlling the outbreak. On the right, I plot the time when lockdown was started and the time when the lockdown ended. India is possibly one of the few countries that locked down very early, but for the reasons that I've just shown you, we also had to open because there were diminishing returns on the outbreak, but there was a massive effect on the economy, on livelihoods. So when India went into lockdown, there were 657 cases and 12 deaths. When India came out of the lockdown, we had almost 200,000 cases and 5,400 deaths. Today, India is pulling about 46,000 cases per day and roughly 560 deaths per day. Next. And here is something about attitudes. So this was an interesting study, an interview that was conducted with people, and two questions were asked across time periods. The first question was, I fear that either I or someone in my family will catch COVID. And what is plotted here is people who agreed. And you will see that initially it was a low percentage. It went up to about 60-65% around July, August, and then the perception started coming down and it's on a downward trend now. Similarly, when you ask people whether they agree that the government's response to the pandemic has been effective, initially in the lockdown period, there was very high approval that the lockdown is doing wonders, but as time progressed, the approval rating has really gone down to some extent, but it's still quite high at around 75%. I would place more importance on the threat perception shown on the left, because it is this attitude of people not really wearing masks properly, coming into a COVID fatigue, which is causing the rises in India and the world essentially again. Next slide. Just a little bit about viral variants. We will discuss more about it. These are variants. These are not strains of virus. So the virus still is a single strain, but there are multiple clades, multiple variants. And this on the left is the global scene based on sequencing of almost 190,000 full genome sequences. And as you will see, there is some level of geographic distribution, but all clades are essentially present in all regions. And the same is true for India. If you see on the right, all clades are present in various parts of India. So there is nothing really special about some clades being geographically localized in some areas of the country. We will discuss more about that, so I'll leave it at that. Next slide. And the other important point to make there is that there is no weak or strong strain, so to say, floating around in India. This is just to remind us that Dr. Kang is here and we will discuss vaccines. The current situation is that there are 50 plus vaccines in human trials. There are various platforms on which vaccines have been made. There are the viral vector platforms, the mRNA and the DNA platforms, and the whole virus vaccine platforms. All of you must be aware of the results of the Pfizer vaccine that have come out yesterday, the mRNA vaccine, and hopefully in the panel discussion, we'll have time to discuss all of that. Next slide. So just some general points. The virus has spread quite fast. It is likely to stay with us for many years. And just like other cold-causing coronaviruses, it's going to become endemic in the population. The transmission and virulence is likely to reduce as more and more people get infected. At this time, there is no specific treatment. All treatments that have been tried have really not stood up very well to randomized controlled trials. Vaccines for COVID, yes, there is hope. But those of us who think that I am in line to get the vaccine, you would be in for disappointment. You are not going to be the one who will be getting the vaccine up front. So what should you really do? Next. Next slide, please. So what you should do is wear masks. And here is the evidence for why masks work. On the left is mortality data from 200 countries, which shows that countries that adopted the use of masks only after 60 days of the outbreak was detected in the country showed high levels of mortality. Those who adopted masks very early in the outbreak showed low levels of mortality. On the right is not virus data, but it's bacteria data. If you sneeze on a blood agar plate with a mask or without a mask, that's what you get. And remember, the virus is not really floating around in the air. The virus is present in droplets, and these masks will stop droplets. Next slide. So basically go out, wear a mask. And again, more data. The Institute for Health Metrics has come out with these numbers, projected numbers, that if there is universal mask use, and universal mask use is 95% people using masks. If that's the case, then you can prevent roughly 800,000 deaths between late August and 1st of January 2021. In India, by the same token, you can prevent roughly 158,000 deaths. So all data, all modeling seems to suggest that masks work, and that should really be the message to go wear a mask. Next. Can I have the next slide? Yeah. So I'm hoping that we'll have some discussion on future pandemics. And this is just to set this up, that viruses form about 14% of total human pathogens, but they account for roughly half of all new and emerging pathogens. And 75% of all emerging viruses are zoonotic in their origin. The key drivers for this appear to be climate change and deforestation. Bats and mosquitoes appear to be the biggest drivers of viruses spilling over into human populations. And examples of bat-derived virus is Nipah virus, which has caused multiple outbreaks in our living memory. Next. Again, to remind everyone that various models have suggested where the next big one is going to emerge from. But if you pay attention to the right part of the slide and look at the developments that facilitate spread, of course, this is obvious. It's commercial air travel, global trade, urbanization, which leads to deforestation, and unchecked population growth, and climate change. But the good news is that there have been advances that facilitate control. Genomic sequencing, for example, I mean, today we are sequencing in real time. In 9 months, we have almost 200,000 viral variants sequenced and available in public databases. There are global communication networks have worked quite well. People have collaborated very well. Diagnostics and vaccines have developed very quickly. So these are all good signs, and hopefully we can discuss some of this. Next. The Global Virome project is one project which really aims to build capacity and discover 500,000 viruses and foster solutions for future pandemics. And if time permits, we should discuss some of this. Can you hit it once more? So how much would it cost to discover 500,000 viruses? And the cost is estimated to be about $5 billion. Next. Seems to be very high, but if you compare this to estimates for COVID, which are pegged at about $28 trillion right now, the cost of discovering 500,000 viruses is going to be minuscule. So I'm hoping that we can discuss some of this. I think that's my last slide. Can you hit it once more? All right.
Thanks.
Wonderful.